So in this tense situation, keeping calm is the key thing, and that's what experience brings to you. And then as we were giving blood transfusion to the patient, we sort of called number one vascular surgeon, who was a very busy number one surgeon for Karnataka, and he said that he's still in OT, it will take some time for him. So plan B, so we had to call the plan B, which the hospital owner also, who was an orthopedic surgeon, had spoken to the previous day. And fortunately he was nearby in a hospital, he knew the surgery was going on. So within 10 minutes, he came with his vascular loops and everything. So we kept the pressure on the whatever which was bleeding. We didn't know it was the artery or the vein which was bleeding. And then the patient was stable, and then the moment he came, the mouth was removed. He had a look through the loop, and he said it's a small 3 millimeter cut in the interiliac vein, and using fine sutures, he put 2-3 sutures on the vein, and then the bleeding stopped, and everybody in the theater took a sigh of relief. So this is the value of teamwork really, and the advanced planning, and how it's going to benefit everybody.